So, good afternoon, conference, and it is really a great pleasure to be here in Liverpool with you. It always feels a bit like coming home when I come to the health conference, so thank you for the invite to come and speak to you. And I also want to thank Tanya, Maura and Tam and all of the SGE for their hard work and for the outstanding leadership that they show in this service group. And I want to thank Helga and Alan Lofthouse and all the national and regional staff who support our committees and branches across the country. And of course, I want to thank all of you as leaders in your branches and regions and the devolved countries for keeping us the biggest and best union in the country in health. Conference, a lot has changed since we met last year in Brighton. Most importantly, of course, we've finally seen the back of the Tories. And after 14 years of cuts, chaos, damage and division, this was a welcome change and one that was long overdue. And conference, let's be clear, and I know some of you might find this hard to believe, but it has made a difference. You can't imagine, for example, a Tory government opting to nationalise rail companies, or a Conservative Chancellor imposing VAT on private schools. And then there's the Labour policies about boosting social housing and investing in green infrastructure. These are all clear Labour policies. But perhaps the most significant change is the Employment Rights Bill, a once-in-a-generation opportunity to boost our members and other workers' status and security in workplaces right across the country. Legislation that will clamp down on zero-hours contracts and the fire and rehire culture, that will bring in day-one rights, including sick pay for millions who don't get it now. And that will also help to bring in a fair pay agreement for care workers, something that's very close to UNISON's heart. This legislation will also help to boost our access to workplaces and give better facilities time to our reps. And it will rid us of the very worst of the Tory anti-strike laws. And better still, it will finally give us electronic balloting. You wouldn't think that was such a big deal, but oh my God, it is. Now, of course, the government could always go further and it could always go faster. I mean, I want to see the planned National Care Service happen much sooner. But be in no doubt, these are all moves in the right direction. And these are moves that are all being opposed by many in the business community, business leaders, by the Tories, and by the Reform Party, who all vote against this whenever it comes up in Parliament. And we have a clear commitment from Labour and government. And unions like ours, and I'm working with the leaders of all the other unions on this, we are demanding that ministers hold true to their promises. But conference, some of the other decisions that Labour have taken have left me, quite frankly, baffled and at times speechless. Stopping winter fuel payments, not giving WASPy women the justice they deserve, and most recently of all, the proposals to overhaul the welfare system are, quite frankly, indefensible. We know the Tory failure has left the government little financial wriggle room, but going after disabled people and vulnerable families, and I have told them this, is not the way to get people working or to boost the economy in this country. These cuts and attacks will place yet more strain on an NHS already creaking at the seams. They're counterproductive, will cost more in the long run, and conference, they are morally wrong. And we expect better from Labour. The government has put much focus on its 10-year plan for the NHS, which we know is due soon. But we know that the way to turn the NHS round is by focusing on the workforce. Conference, it doesn't matter how many times people talk about, AI and the difference that will make, or shifting care out of hospitals, or a new focus on prevention. There's simply no route to fixing the NHS which doesn't start with fixing NHS workers' pay. The very idea that 2.8% will do is ludicrous. Even more so if ministers expect it to also cover the cost of modernising Agenda for Change. The minister said last year that 2.8% was all the government could afford. And let's be clear, that's not an offer on the table. I know a few people said that this morning, but it's not an offer. We haven't actually been made that offer. But that won't encourage experienced staff to stay in the NHS, nor is it anywhere near enough to persuade new recruits to join. And as we know, this year's pay award is already 1 week overdue. I have this image, I think it must come as a shock to politicians and the civil servants and employers every year that the 1st of April suddenly creeps up on them. And I can imagine the conversation the week before, that sort of, what do you mean they're due a pay award on the 1st of April? What, every year? Surely not. You think, why is this such a shock to them? Because I'll tell you, we've been telling them about this for months and months and months. Ministers have ignored union calls for pay talks that could have delivered a decent pay increase on time. So, Conference, we're not looking for trouble. Sound like Elvis there, don't I? And I'm not going to sing it or even try and say a poem. But if we have no choice, don't be in any doubt, we will absolutely come out fighting. You voted this morning on a strategy, and now we need to make it happen. We need to hear from everyone in this pay consultation, because we need to send a strong message to the government. Ministers need to show they are different from what has gone on in the past. They must avoid making the mistakes of the past. Ministers could take a leaf out of the Scottish playbook. Earlier today, an above-inflation 2-year pay offer was put to the health unions in Scotland and included a guarantee the NHS staff in Scotland would get 1% more than inflation should it go up. Now, it will be for members in Scotland, I know, it will be for members in Scotland to decide whether this is good enough, but at least what it shows is what can be achieved with direct talks with governments, something a painfully slow pay review body process just hasn't been able to do. But pay isn't the only area, as you know, where there are problems. I mean, just look at the proposed abolition of NHS England. I used the term shambolic to describe it when it was announced, and it was. We had members who found out from watching the television that their employer was disappearing. That's no way to treat staff, and it's no way to run the NHS. The Conference, we know the Tories left behind a terrible legacy. Not just underfunded services, but a system too often dependent on outsourcing. Well, we will always fight privatisation, just as we have in the East Suffolk and North Essex Foundation Trust, where cleaners, porters, housekeepers and other facility staff have taken 40 days of strike action in the past year. And just as we are in the South West, where members continue to fight the mass outsourcing of community services to HCRG, the company that used to be called Virgin Care. And what about NHS England? I know you mentioned this morning, calling on trusts to outsource their support services to subsidiary companies. That old chestnut subcos. I mean, it's a bit like vampires, they just don't know when to die. Because, of course, we have been here before. fighting the same sort of campaigns against trusts who were seeking to exploit a tax dodge while threatening terms and conditions by creating a two-tier workforce. Well, Conference, it was the wrong approach then, and it's the wrong approach now. The government has promised the biggest wave of insourcing for a generation. It's also said measures in the Employment Rights Bill will put an end to the two-tier workforce. Well, urging trusts to offload their porters, cleaners, security guards and catering staff to arm's-length companies flies in the face of this. Something I'll be making very clear to the new head of NHS England when I see him this month. I'm quite looking forward to that meeting. So we've written to every trust in England to warn of the damage that would be done by hiving off these groups of workers in this way, and to remind them about the places where we fought off subcoal plans in the past. From Wigan to Frimley, from Bradford to Bristol, from Rotherham to Leicester. Conference, we've won these battles before and we'll win them again. Because if they come after one of our branches, they come after all of us. So whether it was the Tory Lib Dem coalition when they first came in, trying to impose local pay rates, or the Northern Ireland office holding back their pay increases, or the SNP trying to divide and conquer in the past among different health workers, and listen carefully, or a Labour government anywhere in the UK, we will take them on. Our union's first priority, my first priority, will always be to defend our members' rights. And I give you this commitment. Nothing will stop me or this union from doing just that. All health workers, no matter what jobs you do, want to be able to give vital, timely care to patients. You don't go to work to see people in pain lying in hospital corridors waiting for treatment, or to watch patients deteriorate or even die in the backs of ambulances because of excessive handover times. But this is the grim reality for some paramedics and emergency medical staff. Sometimes spending entire shifts queuing outside hospitals, stuck, unable to attend the emergency calls coming through over the radio. Ambulance workers, like other health workers, want to do the very best for people who are sick, for those who need help. But ambulances have now become temporary treatment centres. Car park care has too often become the norm. But Conference, it's impossible to come to a conference like this, a health conference, and talk about what's happening in our NHS and not mention the appalling violence facing health workers in conflicts and war zones around the world. In particular in Gaza and Palestine, workers there risking life and limb to save and care for people. All too often it's children who are the victims of this indiscriminate violence. And what increasingly seems like a determined effort to drive those remaining Palestinians from their homeland. And as we know, health workers are also often the victims. The 15 paramedics and civil emergency responders assassinated by the Israeli military last month. Despite travelling in ambulances with flashing red lights, their bodies found in a mass grave. And I ask you, if that's not a war crime, then what is? I visited Palestine last year as part of an international union delegation, and I spoke to public sector workers. I met the leader of the union, the health union in Ramallah, who works in a local hospital. He told me a little bit about his daily life, and what should be a 20-minute journey to his work, a car journey, takes at least 3 hours. That's when he can actually even get through to his work, because he's always stopped at numerous Israeli roadblocks. And he says, not for any reason, just because they can. I've been taking my lead on what we do from our contacts in the Palestinian unions and from regular contact with the Palestinian ambassador in this country, working mainly with the other Labour-affiliated unions to keep up pressure on the UK government. And I know how generous you have all been in the past, but we will be launching a new appeal shortly to support medical aid for Palestine. And I also urge you all to take part in the local days of action being organised in the next few months. Because whilst it may seem that politicians and the media have forgotten Palestine and Gaza, we will never forget. I will give up the fight for justice and, critically, to protect those health workers just going about their daily business. Conference, this past year I've been up close and personal, a bit like James said this morning, with the NHS and the care system in our country in a way that probably most of us hope never to be. As some of you may know, my husband became very ill last year and sadly died in November. Before that, he spent 6 weeks in hospital, and for the last few weeks of his life, I helped care for him at home. I saw firsthand the pace of life in a busy acute medical ward and the dedication and skills in a specialised cancer ward. I also saw the difference between care staff from a local hospice where unions are recognised, UNISON, the staff are on permanent contracts and the staff are trained and supported. And then I saw the carers from a private company that we were put onto that were neither trained nor supported, and it was not their fault. They were part of a system where the company was more interested in profits than patient care. And not that I needed to be convinced, but I saw too why Pay Fair for Patient Care is such a brilliant campaign. I met a specialist phlebotomist when my husband was in hospital. She came in regularly to find a vein in his arm, and she had a little ultrasound machine. And she was brought in by the specialist nurses on that ward because of her skills. And when I got chatting to her over the course of those weeks, she was a Band 2, still a Band 2 phlebotomist. I saw nurses regularly working way beyond the end of their shift. And I saw healthcare assistants going way above and beyond what they were paid for. And that's why our campaign has been so successful. As a union, we've already won an amazing £154 million in back pay. That's astonishing. Putting money directly into the pockets of as many as 40,000 healthcare assistants and other NHS workers. Some have had to take strike action to get it, and others have been able to use the threat of walking out to win fair pay and back pay. But what all have in common is UNISON branches and regions who are ready for the fight, who are organised and who are determined to win for members. I know we're going to be celebrating those wins immediately after my speech, but I just want to send support today to the phlebotomists in Gloucester and Cheltenham taking action this week, and I think we're hoping to join them, and the healthcare assistants in Nottingham who I'll be joining on the picket line on Thursday morning. I want them to know their union stands in total solidarity with all of you. All of this makes me very proud to be General Secretary of this union. I know that when I was off last year on bereavement leave, some people seemed to think I wouldn't be back. But I'm here. I'm still your General Secretary. There's still another 8 months to run in this, my first term of office. So, I'll say it again, I said it once before, there is no vacancy. And when there is, you'll be the first to know. Thank you. We have so much to celebrate as a union. Thanks to all of you, Last year, we recruited over 200,000 new members for the first time ever. What a fantastic achievement. That's more than most of the small unions in the TUC have in membership. And that's down to your hard work and our successes. And yes, we did use organising to win tactics. As James Anthony said this morning, when I stood to be General Secretary, I promised a new organising strategy, and I delivered it through you, through our branches and our regions. But do you know where that organising to win strategy actually started? Here at this very conference back in, Helga and I were trying to remember, but we think it was about 2017. I was the head of health, and you agreed the strategy that was called the Earnings Max strategy. Do you remember it? Some of you might be here. And that's where we started these campaigns about identifying local issues where we could get members actively involved in. And that turned into Pay Fair for Patient Care. And that success is absolutely down to you in this room. So, conference, the Tories may have gone, and good riddance to them, but it doesn't mean that all our challenges have gone with them. That was never going to be the case. It means we have to keep doing what we do best, building strong branches and regions, boosting our recruitment, not just to become bigger, but to become stronger and better at winning in workplaces, but also speaking out in support of services, fighting outsourcing wherever it raises its ugly head, and repeatedly, constantly making the case for our NHS. Conference, we have much that we can be proud of and much more that we still want to achieve. And I know that when we work together, we are more than a match for anyone. Thank you. Thank you.